Accessible and adequate healthcare still remains far-fetched for most Filipinos, especially for those living below the poverty line. Because of their financial and social status, indigents often choose to forgo their well-being, thus risking their health even further. And with the high poverty incidence in the country, the increase of poor families also means a higher demand for healthcare services. Addressing this societal problem can be overwhelming, even for the national government. That's why the private sector does its fair share of nation building through their CSR programs and initiatives. Seeing the importance of addressing health concerns in the country, the largest and most diversified conglomerate in the Philippines, in partnership with its foundation, answered the call by providing qualified indigents free healthcare services through their community clinics.
The health program that we have, it started when every medical mission, we would ask our president of the corporation, Mr. Ramon Ang, for his approval for medical mission. Then he said, you know, these medical missions, this is one-shot deal. And then he told us, why don't we come up with community clinics?
At present, the corporation has 6 community clinics located on sites and off-site. Unlike medical missions, the community operates year-round, with the clinics open 5 days a week for 4 hours a day and with a permanent doctor and nurse manning the operations. This provides not only better access to healthcare, but also specialized services to indigents. These community clinics, though small in scale, provide specialist care, particularly for patients suffering from diabetes, tuberculosis, and cardiovascular diseases. Medicines provided to qualified beneficiaries also come free of charge.
Because they don't have the money to go to specialists. It's very easy to go to a general practitioner if you have the money. And they said it's like 300 to 500 pesos. It's really a burden for the families, for the patient himself. More so for specialists. You cannot just go to a regular doctor to detect what's your sickness. If ever you're diabetic, you have to go to an internist. At the same time, for those with tuberculosis, you have to go to a pulmonologist. And that would cost like 800 to 1,000 pesos. But we have a doctor, a specialist in the clinic who would see them free of charge and would give them the right medicines.
Providing free access to healthcare services is just a single component of the multinational company's health program. And to make this operation truly work, a deeper sense of commitment is also needed from its qualified beneficiaries.
The medicines are free of charge. If you're going to compute it, it would be in thousands of pesos already, for one patient alone. Because we actually give medicines good until the next visit. So we have to make sure that they take their medicines and regularly be checked by the doctor.
Taking care of one's health is serious business. That's why the community clinic provides qualified beneficiaries free medical consultations and medicines for diseases that require long-term attention or supervision. And since 2014, there are over 8,000 qualified individuals who have benefited from the 6 community clinics of the company and its foundation.
It's very important because I believe that, health is one of those important in a person because you cannot function well. How can you go to school if you're weak? If you haven't eaten, how can you work if you're weak? How can you do your day-to-day activities if you're sick? So these are very important things that we have to address in the community. The company is very much aware that there's a need, there's a gap between the government, between the private sector, and those beneficiaries. So how can we as a business sector can help that gap? So that's our way of helping our communities.
Yun nga ang kagandahan. Meron silang access to general health care, and kung mamamanage din lang namin yung specialized care nila, we manage.
Kasi po parang sa amin pong mahirap, pag po specialist ang sinabi yung gagamot sa'yo, parang nakakataas po ng ng pagkatao. Alam mong gagaling yung sakit mo, kaya po talaga regular yung check-up po, tsaka libreng gamot.
Kung hindi ako napagpa-check up sa community na yan, sa tulong ng San Miguel, baka ako hindi na tayo nagka-interviewhan ngayon. Lumala na yung sakit ko. Kung hindi ko asikaso yung sakit ko at lalong lalala, baka madali ang buhay ko.
This community clinic in San Fernando, Pampanga caters to indigents from 3 different barangays. So far, the clinic has 102 qualified beneficiaries, handling cases of up to 20 patients a day. Among them is 52-year-old Alma Basco, who suffers from cardiovascular disease.
Dati po, nung hindi ko pa po na alam na may sakit po ako sa puso, garbage collector po ako ng barangay. Nagwawalis po ako sa daan. Doon po, nung po nahilo ko at dinala po ako sa ospital, doon po namin nalaman na may sakit ako sa puso.
Before being a beneficiary of the community clinic, Alma chose not to follow through with her medicine and checkups due to financial constraints, opting to just continue on working just to be able to provide support for her family, even with her measly income as a garbage collector.
Kahit po kasi may nararamdaman ako dahil po may sakit po yung asawa ko noon at nag-aaral po yung mga anak ko, hindi ko na po iniintindi yung nararamdaman ko. Kung konting sakit na lang po, binabaliwala ko na lang po dahil nga po gusto kong makapagtrabaho at makapag-aral yung mga anak ko.
Alma was also discouraged from seeking further treatment because of the volume of patients in their regional hospital. Aside from wasting at least a day waiting in line, doling out fare just to get to the town proper also is a burden on their tight family budget.
Mahirap po talaga kasi po dahil po unang-una dahil nga po parehas kaming may sakit ng asawa ko, yung pong gamot, minsan po pupunta nga po kami dito sa clinic, hindi naman po lahat na ibibigay. Talagang sobrang hirap po dahil po nag-aaral yung mga anak ko, meron akong asawang may sakit. Inuuna ko na po minsan yung sa gamot ng asawa ko, inuuli ko na yun sa akin. Kaya po medyo lumala yung sakit ko dahil nga po hindi ko po natutugunan talaga yung mga gamot ko noon.
72-year-old Jaime Judicial also found it taxing to seek treatment for his diabetes because of the arduous process of government hospitals. Unlike Alma, who is still able-bodied to earn a day's pay, Mang Jaime's age restricts him from laborious activities. With no means of earning income, Mang Jaime feared for the worst, because aside from diabetes, he also suffers from a respiratory illness.
Nung malaman ko may diabetes ako, medyo nag-alala din ako dahil marami ko nakikita may diabetes na napuputulan ng paa, wala akong pambili ng gamot. At pangalawa, natatakot ako magkaroon ng diabetes. Kailangan ito, makapagpa-check up ako. Paano naman ito kung pambili ko ng gamot, wala naman akong pera. Ang naging ano ko pa, yung emphysema. Akala ko asthma eh. Eh pala, asthma at emphysema na wala na, lifetime na raw yun, hindi na raw gagaling. Nahihirapan akong huminga. Pagka kinapagod, humihingal ako.
Mang Jaime and Alma's concerns are identical with the issues of other indigents in the community. That's why things took a turn for the better when the corporation implemented their community clinic in the area. This provided a breath of relief for patients in dire need of healthcare.
Malaking tulong yung community clinic kasi nga nakakalibre sila ng gamot and libreng check-up. So before talagang minsan nahihirapan sila kasi they have to seek medical consult sa mga private clinics or dun sa regional hospital natin na medyo hindi malapit dito.
In line with the company's commitment in reaching out to the communities they operate in, through the implementation of their community clinics, this program enables help with the prevention of diseases, extend a dosage of cure, that in turn helps create a healthy community. As health is equivalent to wealth, the presence of these community clinics is the response of the company to the call of the private sector to do their share in helping augment the country's health program.
Of course, pag primary care ka kasi nandun ka sa preventive stage. So, you delay the progression para maging delikado siya. So, in a way, nade-delay mo yung progression habang maaga pa. Medyo matagal pang dumating yung complication na yun. Nakakatulong talaga pag ganun. Yun nga ang kagandahan. Meron silang access to general health care, and kung mamamanage din lang namin yung specialized care nila, we manage. Ang pagkailangan talaga na specialized care, that is the time we refer them outside.
No longer a strenuous task, both Alma and Mang Jaime now enjoy ease of access to specialized healthcare service with just a few steps away from their community.
Kasi po parang sa amin pong mahirap, pag po espesyalistang sinabi yung gagamot sa'yo, parang nakakataas po ng pagkatao. Yung specialista yung titingin sa'yo, siyempre po, alam mong magaling. Kaya alam mong gagaling yung sakit mo, kaya po talaga regular yung check-up po, tsaka libreng gamot.
Kung hindi ako napagpa-check up sa community na yan, sa tulong ng San Miguel, baka ako hindi na tayo nagka-interviewhan ngayon. Lumala na yung sakit ko. Kung hindi ko asikaso yung sakit ko at lalong lalala, baka madali ang buhay ko. Kaya sinasamantala ko yung tulong na nagagawa ng ating community ng San Miguel. Kaya sinasamantala ko yung pagkakataon na gusto ko pang umaba ang buhay ko.
It is important not only for SMC but to other corporations as well. It's actually giving back to the community who helps us, when it comes to our sales, when it comes to industrial harmony, industrial peace. We have to give it back to the community and do our CSR activities in the areas wherein we operate. That's how we do it. We don't dictate to the community what projects they're going to implement, but actually we hand in hand with the community in participation of the community leaders, the community members, the residents, on what are the projects that they need and what are the assistance they actually need.